This is the pill that was given to thousands of pregnant mothers, once seen as a wonder drug, but their unborn children were being poisoned in the womb.
I'm 40 times more likely to get cancer.
We've been investigating the sinister and lasting effects of the drug known as DES for years. And now the government is taking action to find out just how far and wide this scandal goes. In 1970, Jennifer Bradley was given an anti-miscarriage drug for 6 months of her pregnancy. She was told Stilbestrol, commonly known as DES, was completely safe. Yet there was already mounting scientific evidence of the drug's sinister side effects.
I was always concerned about it, and I never forgot the name of the drug.
When you raised concerns, your worries about the impact of the drug, what did the doctors say to you?
He wouldn't even look at my notes, and he completely dismissed it. And he said that you don't worry about things that may never happen. You may walk out of here and go under a bus, so don't worry about it. And that was it.
They were the words he used?
Oh, absolutely, yes.
The truth was her daughter Susie was being poisoned in the womb.
It clearly says there that I was DES exposed in utero and developed problems from there.
She's had lifelong gynecological problems. Since her teenage years, she's had more than 20 surgeries to remove abnormal cells.
What have doctors said to you about the increased cancer risk?
I'm 40 times more likely to get cancer than people that aren't DES exposed. It's not just reproductive cancers, it's breast cancer, there's also evidence of pancreatic cancer. You've got all that worry hanging over you, you're suddenly going to get some life-debilitating illness.
DES is a synthetic hormone. It was prescribed to thousands of pregnant women between the 1940s and 1970s. Once hailed a wonder drug to prevent miscarriage, it's become a medical disaster, leaving behind a devastating trail of rare cancers and infertility in the children of those who took it.
Pregnant women used to swallow DES pills by the handful.
The harm stretches right across the globe, but our investigation found that warnings about the dangers of the drug were not acted upon by authorities here. The links to cancer were ignored for years.
I think this is one of the great, scandals that we have in our health system, that the years roll by, the health system doesn't listen, the government doesn't act, and patients may experience cancer, they may experience other harm, and may die waiting to get an answer. I think that's totally unacceptable, and I think it's absolutely vital that we don't delay any longer.
It was only by scouring through the public health archives that exposed the scale of failure, leading to an apology from the medicines regulator for misleading the public for 25 years over when DES was withdrawn from use.
More could have been done by the regulators, so there must be accountability and responsibility in there.
Now ministers are taking action. NHS England has set up a DES advisory group made up of senior clinicians to make sure women are getting the right treatment. Ministers have asked the University of Exeter to lead a research project into the intergenerational impact of DES over the next 6 months. It will also help to determine whether lifelong cancer screening is needed. And the medicines regulator has been asked to find medical records detailing just how many women were given the drug. The Labour MP leading the calls for change at Westminster warns that many doctors still don't even know about DES.
One woman I met had to buy a medical encyclopedia herself just to try to find out what was wrong with her. Symptoms are minimised, pain is diminished, women aren't believed, they're ignored, often dismissed. And this goes back to why it's so important that GPs know about this issue and know about some of the symptoms, complications that these women can face. Because at the moment, they're just getting told nothing's wrong with you.
Alongside specialist treatment, what many DES women now want is a full public inquiry into how they were failed so catastrophically for decades.
Hearing the truth about what happened, understanding that it wasn't their fault, and that the guilt that they carried wasn't theirs to carry at all, it is such an important thing. truth without accountability it causes more harm than not, and it's a vital part of our campaign.
Meanwhile, families are still trying to make sense of what happened and the lifelong consequences.
We don't know what's going to happen eventually. How many generations will it affect?
So you want this research done now? And
now, as soon as possible.
Hearing Susie describe what she's been through, how does that make you feel?
Well, I was absolutely furious, but also I just feel so guilty and so sad about it, you know, that this has happened. And I asked myself, should I have taken it? Should I have just ignored it?
After years of being dismissed and disbelieved, DES women say they will not be silenced. Sarah Corker, ITV News.